Today I'm not going to tell you anything about a national dementia strategy for Austria, since there is no such strategy yet. No? I'm going to tell you something about an integrated care plan that was developed with experts and patient representatives on a national level on initiative of the Austrian social health insurance institutions to improve dementia care in Austria, and also to suggest one way of or one approach on how a strategy for dementia could look like for Austria. Yes, before I will go into detail, I would like to tell you something about the Austrian social and healthcare system, just to make clear why we did things. Austria has about 8.4 million inhabitants. These inhabitants live in 9 regions, and these 9 regions all have their, or federal states all have their regional governments. Within each region, we have one social health insurance institution that's assigned to the region, but altogether we have 19 social health insurance institutions. The social health insurance institutions are in charge of outpatient care or extramural care in terms of medical care within the communities. The regional governments are in charge of hospital care, the inpatient care, and also for nursing care and social care. So you can see that we have quite a lot of decision makers and sources for funding for different things that are very interconnected. And that leads us to have a system with lots of fragmentation, although we're just such a little country. The Austrian social health insurance institutions have therefore decided to build or set up the Competence Center for Integrated Care, and gave us the task to work on pressing healthcare problems which are related to fragmentation and could be improved through integrated care, especially for chronic diseases or for people with multiple health problems. For those of you who are not familiar with the concept of integrated care, I've brought you along our definition of it. There are lots of others around, but we consider integrated care to be patient-oriented and continuous, and the care concept that's based on standards, guidelines, and pathways, and is provided across service sectors and also across professional borders. This may explain why we are a social health insurance institution where our traditional focus is on medical health care, and lots of dementia care is not placed within this, but in social and nursing care. And this definition explains why we were looking into it, because we are trying to look across the borders and to bring together the systems. Well, the reason why the Competence Center has exactly chosen to work on dementia was a prioritization process in 2008, where diseases which have a need for improvement in care have been selected and then prioritized according to their potential when you use integrated care to improve them. And dementia has been chosen, along with osteoporosis and heart failure, to be on the top level. The first step towards the integrated care plan was to analyze the current situation of care. And the first analyses have shown that one of the core problems is the fragmentation of the system, which was not exactly surprising to us. But especially with dementia patients, it is a problem if they have to consult healthcare professionals from different professions at different levels, and have to bring their patient records by themselves to ever-changing other health carers. From a system perspective, one of the main problems is related to the demographic change. We are facing a rising number of patients who will need appropriate care. Since in Austria most of the care for dementia patients takes place in the communities, in the outpatient area, the social health insurance institutions have decided that it is necessary to work on that area and to develop a plan which can be used on the whole nation for the integrated care of people who will stay at home with it in their communities. Before I will tell you about what the concept is about, the contents, and how it's supposed to be put into practice, I have to tell you that it's not implemented yet. We have completed the work on the concept, and but I'm going to tell you a bit more about that later. Inputs from literature research, the analysis of the current situation, and from expert working groups have been merged, and the topics that were worked on have always been concerted again with experts. The result of this work was an adaptable network structure for the community setting, which is based on case management, and evidence-based care from the medical perspective. Since we have 9 regions with differences in the healthcare and social care system, it was absolutely necessary to make sure that whatever we develop is adaptable to the structures in the 9 regions. The concept contains measures on 3 levels. On the institutional level, it's a network management, which is in charge for the implementation and the further development of the network. There is always also a care management, which has to provide the requirements for appropriate care management within this setting. On the professional level, we will need doctors for primary care and specialists in dementia care, as well as nurses, therapists, hospitals for acute care, and daycare centers. These daycare centers, along with other assisting staff, to, on the one hand, facilitate the stay at home in the community area, and on the other side, to support the carers and to enable them to stay healthy and to tackle the burden they are actually facing while caring for people with dementia. We have suggested to also use case management, if necessary, to help plan the individual care for the people with dementia and to enable them to stay at home. On the quality level, a medical guideline was developed by the Medical University of Vienna, which is focusing on dementia diagnosis and the treatment within the Austrian framework that we have. There is a measurement package for education of health professionals in terms of work within an integrated care program and communication with dementia patients. There's also a package for empowerment, which focuses on appropriate information at the right time. And the main part, or the most important parts of the quality package is that there are supposed to be quality cycles and network meetings to actually improve the collaboration of the people within the network. We are well aware that such a system will not work if there is not a proper information and data management. That's why we have also suggested to implement something like this. I'm not sure if you know that in Austria we have plans to set up an electronic patient record for the whole of Austria, but this one takes quite long for those of you who are from Austria, and ELGA is not ready yet, and we don't know when we will have it, so we have suggested alternatives. So once a person gets the diagnosis dementia, he or she will be informed about the network and the network care, and can choose to either stay within normal care or opt in for care within one of the networks in the regions. The reason why we need this opt-in is that we have to provide the legal background for the data transfer. And as long as we don't have a national solution for that, they need to say that it's okay if the network uses their data to care for them. Once they opted into the network, they will be contacted by a case manager who is assessing the situation and, if necessary and wanted, provides case management or advisory service. The whole system has the aim to avoid that people are relocated to nursing homes too early, while they would, with the necessary support, be able to stay within their community. We would like to avoid over, under, or misprovision of care, since that is still a problem. And we would also like to, or another aim is to improve the situation of the family carers. Another thing that's important to us, since that is also a problem in Austria, is that the diagnosis is right now, the diagnosis of dementia happens quite late or not. And we think that once there is a care plan, this diagnosis will happen earlier because there is just more awareness for this. As I've mentioned before, it's not implemented yet, but the first region which has started the adaptation process and also completed this is Vienna. And the next step in Vienna will be to take the decision if it's going to be implemented or not. If it's going to be implemented, we will of course do a sound evaluation and provide the other regions with the base for the decision if they want to implement it and spread it to the whole of Austria. And if there is going to be a national strategy for dementia, we hope that the results from this will also be valuable. I would like to thank you for your attention and hope that I was able to give you some insight on how Austria is approaching dementia care right now. Thank you very much.